Hey, Martin.
Yes.
I'm going to be chatting with you just offline in Teams.
Okay, I closed it because I kept getting messages from it.
Okay.
So I'll open it back.
Hey, Mark.
Hey, John. How you doing? Thanks again for doing this.
Yeah, good morning.
Good morning.
Okay. So seeing it as it is just after 10 o'clock, I'm going to kick things off. I want to welcome people for joining us this morning. My name is Martin Daly. I'm the Director of Water Quality Programs at the Capital District Regional Planning Commission. For those of you that aren't familiar with regional planning commissions, we actually have our Executive Director here with us, Mark Castiglione, who is probably the best person to be able to share a little bit about us, our history, very briefly to give you an introduction to our organization. So Mark, I'm gonna ask you to take that away if you could.
Great. Thanks, Martin. And thanks to everyone for joining us here today and to kick off our webinar series. We're very excited to have a couple great topics for discussion and timely topics. This program is a continuation of CDRPC's services to provide planning and zoning board members credit and to advance the conversation of regional planning throughout the Capital District. So again, we're excited to have you here today. In lieu of our in-person events that we had scheduled for May, our annual spring planning and zoning workshop, we're now offering a planning and zoning webinar series, and we anticipate that these will continue through the spring, if not into the summer. And again, we think this is a great way to continue to advance the conversation in the region during these trying times and to connect with our constituents in a new way. So we hope today's presentation you find informative, thought-provoking. I know, having participated in some conversations around this topic with the panelists, I will be very much interested in what they have to say. So without further ado, I'll turn it back over to Martin for the introductions. And again, thank you everyone for joining us today on our webinar.
Thanks, Mark. I want to thank everybody for taking the time this morning to join us. A little bit of housekeeping as we begin this process. Please note video is set to default off and mics are muted. We do that for security purposes, but if you do have a question, please utilize that chat function. It is dead center in your screen. It's a little cartoon window as if a cartoon character was saying something. If you type in a chat, either Mark or I as moderators will be able to relay that to our panelists as we move forward. We are recording this, so CDRPC will be able to archive this webinar on our website. So if there's something that you miss or you want to share this with a colleague, please note that. We will certainly share the information on where it ultimately gets archived on our website or linked to in the future. This is our first one, so please bear with us as we try to navigate through this process. But that being said, we are going to have a series of webinars throughout the summer. And so next week at 10 o'clock, we're going to have another webinar. That one is titled, "That's Not What I Thought I Was Approving." It's going to be a really good look at what planning and zoning boards get presented to them and what happens in the real world. Look at some case studies as what happens when something is built that isn't quite what the municipality anticipated.
And Martin, I'll just note that one of our chatters pointed out that we have the wrong hour listed for next week's webinar. So
thank you very much. We will certainly fix that.
We will correct that. So thank you for that comment.
Yeah, great. Presenting today, let's get to it. Presenting today, we'll have this session split into two. Our first session will be John Steinmetz and Ted Kolankowski from Barton Loguidice. And our second portion will be Jennifer Ceponis, a senior transportation planner for Capital District Regional Transportation Committee. So we hope we'll stick around through the whole thing. With that, I do want to turn it over to John and Ted, who will talk about planning for the new normal, post-COVID-19 planning and zoning discussions. Certainly, we're going to see a number of different types of impacts coming out of this. And John and Ted are really great for joining us and kind of talking us through some of the trends that could be possible when we start to recover from the COVID-19. Take it away, gentlemen.
All right. Thanks, Martin. Thank you, everybody. Thank you, CDRPC. It's a pleasure to be here this morning. And I wish we could all be together in person. And if that were the case, obviously the topic would be different. I'd like to start by saying I hope everyone who's on the call is healthy and family and loved ones are safe and sound during this crisis and pandemic. And, you know, Ted and I appreciate that it's a scary time, it's a challenging time. And I think as we were putting our heads together on what to talk about and how to talk about it, you know, the topic seemed obvious, but what to say seemed challenging. You know, as planners, we've had a lot of dialogue with constituents, colleagues, family members, about, you know, what is going to be the new normal. And I think the new normal, in my opinion, and one thing to preface and qualify this presentation is these are clearly our thoughts and opinions at this point. So little is known, and it's to say it's anyone's best guess is an understatement. But the way I think I've kind of settled in my thinking is I'm an optimist, number one. So I'm thinking in, you know, a 2-year increment, and my hope is that in the next 2 years, we get back to more of a normal, meaning there's a vaccine or some protocols in place where we can all feel a lot safer, similar to how we felt 5-6 months ago, you know, and I see that hopefully happening in the next 2 years. And then, you know, then within the next 5 years, I think hopefully things get back to something similar to what we had before, but hopefully better. You know, I'm like I said, I'm an optimist, and I think our community should continue to improve over time. So I think, you know, in 5 years from now, hopefully we've created better places in spite of the pandemic. A little bit about myself, and then I'll let Ted talk about him. As Martin said, I'm a consultant with B&L. I'm a certified planner, and I've had stints in the public sector. I was actually a staff person to the City of Rochester Planning and Zoning office for a number of years before I went into consulting. And I was also chairman of my local village planning board. So I've spent my time in the public sector grappling with the issues that as board members, planning and zoning board members and commissioner members that you folks are, I've wrestled with those same issues. That's why I got a big kick out of next week's topic. I've got a good anecdote along those lines as well. So with that, I'll turn over to Ted, and he can introduce himself.
Hi, everyone. I'm looking through the list right now, and I think I know probably half the folks that have tuned in here, so many of you know me. Registered landscape architect here with Barton Loguidice in our Albany office, and I've been in the field for about 30 years and in the Albany area for about 30 years. So I'll turn it back over to John.
All right, let's jump in. Never at least in speaking for myself, and never in my career have I seen so much dialogue, national dialogue around planning related issues, obviously because of COVID. These are just a handful of the headlines from the last few days. You know, and all the articles I've read, and some of these articles I think are extremely compelling and valuable. Not going to recap them here today, obviously, but I think headlines such as nothing about New York's outbreak was inevitable. Politicians and pundits are acting like the city was destined for the tragedy if they're wrong. America's biggest cities were already losing their allure. What happens next? Planners and pandemics, identifying problems and providing solutions. And the one that came out 2 days ago, which again, I highly recommend you take time and read, that pandemic will change American retail forever. And I am going to talk a little bit about this. Some of his points in this article are extremely timely given this presentation. So we'll do a light dive into some of that author's thoughts. So what will post-COVID planning and zoning look like? Again, as I said at the outset, we don't know, but we've got some thoughts. And if we're a more traditional setting, you know, I am looking to hear your thoughts on this and have some dialogue as best we can using the technology that we have available to us. So one of the things Ted and I talked about was, let's talk about the trends that we were talking about prior to COVID. So just we've been on lockdown for about 7 weeks. So just 2 short months ago, what were we talking to clients about? What were the topics? What were the concerns? And I think many of those, if you take a deep breath and look at those, many of those are still going to be extremely relevant after COVID, and then we'll link up with COVID planning. So I think it's beneficial to take a deep breath, talk about the trends that we were faced with, and then talk about how are they going to interface with a COVID future for the next 12, 24, 60 months. So one thing we spend a lot of time talking with communities about is their community mindset, and how complacent or aggressive they want to be with changing and enhancing their communities. And I've done whole presentations on this, but in a nutshell, there's two mindsets in my opinion. There's a transactional or managerial type mindset of communities, and there's transformational or visionary mindsets for certain communities. And there's actually a few more, but those are the two primary ones that I think we see most often. And, a transactional mindset in a nutshell is essentially keeping the doors open and focusing on the business of government, which is important. Leveraging taxes, maintaining infrastructure, repaving streets, things of that nature. Utilizing seeker and, keeping legal comments and engineering comments to board members like yourself flowing, so the projects are in the public's best interest and safety and all of that good stuff. Transformational communities think about all those things, but also capitalize on opportunities to enhance their community. So what do I mean by that? So here's an example of a photo I took in a village in upstate New York in the late 90s. I think this was probably 1998, 1999. They were presented with New York State Department of Transportation with a complete street reconstruction of their downtown. And New York State DOT's preliminary first plans came through and said, hey, let's eliminate the parking and put 2 travel lanes in each direction and really make this easy for cars to get in and out of your downtown and really strip it of any kind of character. The village said, no, thank you. We think we can do better. So rather than just a replacement in kind for this Main Street reconstruction, the village said, let's use this as an opportunity to enhance our public realm, starting with that. This is the result. I took this a few years ago and my wife and I went to spend some time there. So they went from, in some instances, a 5 to 6 foot sidewalk to a 20+ wide sidewalk, nice landscape buffering for the landscape architects in the crowd. And this transformational street project has really spurred the entire village's vitality quite remarkably since the late 90s to now. So I think that transformational mindset is going to be critical moving forward to make sure our communities don't become boring and sterile in light of COVID. Other trends we were seeing, making sure people are connected. I saw an article a few years ago, people who are alone and lonely are at greater risk of heart disease. And if you're a data geek, statistic geek like myself, more specifically, the University of York found that people who are lonely or socially isolated have a 29% higher risk of disease, they found. So the idea of making sure people stay connected socially with their family and friend network is critical. And I think that's going to be extremely challenging to do as we move forward with COVID, but I think that's something to keep our mind on going forward. Obesity, still a thing. Public health, young people of all ages, all age groups struggle with obesity. Estimated 6 out of 10 adults in New York State are classified as overweight or obese. So that trend hasn't changed because of COVID. So when we talk about being active and socially connected during COVID, it also will help to, and post-COVID, it will help to address some of these other trends that we are struggling with as a society. And one of the easiest ways to stay connected and stay healthy is walking. So people who live in walkable neighborhoods with sidewalks were 47% more likely to be active at least 39 minutes a day, according to the AARP. So I think walkability is going to be paramount moving forward in light of the new normal that we seem to be facing. Our population is still getting older. Baby boomers still getting older and clipping, new person turns 65 every few minutes. So I think that trend is obviously still here. So we still need to think about it. And this one gets a little more deep dive into statistics. So bear with me for a minute. I think our housing trends were very interesting. Up to 2 months ago, this was still relevant. So that let's talk and think about how this might change going forward. what kind of housing were people looking for recently, up until recently. So these two charts represent a 20-year time period. So from 1990 to 2010, what were people looking for? In a 20-year period, a person might buy multiple homes. They might move from their starter home into their larger raise your family home type of thing. So this is encapsulated in this information. So in a 20-year period, out of all the home buyers and home purchases that were done, 70% of them were their peak house. So 77% of home buyers at some point in that 20-year period were looking for their largest house to raise their children, multi-bedroom, multi-bath type scenario, while only 23% were looking to downsize. So 3/4 at some point in that 20-year period were looking for the large house, only 25%, 23% were looking for something smaller. Fast forward to 2010 to 2030, which we're smack dab in the middle of, being 2020. In this 20-year period we're currently in, 3/4 of the folks are going to be looking to at some point downsize. So it's essentially flipped. So you've got people were traditionally not looking for their forever home, but looking for something smaller, more manageable, etc. And how does that look to our supply? This essentially shows on the left. I need to update this now. The new census will help me update this in a couple of years. Our preference in 2011, after the last census was released, 25% of folks were looking for large lot homes. About 38% were looking for some type of attached living arrangement, and then smaller lot, patio homes, things of that nature. About 37% were looking for that type of living arrangement. You look at what our supply was in 2011 during that same time, complete mismatch. About over half of our supply were conventional or large lots. So you had 25% of people wanting large lots, but 53% of homes were large lot. And then you look at the other disconnects, 38% wanted attached housing, but only 30% of the housing supply was attached. And 37% wanted small lots, and only 18% of offerings were small lots. So you see that there was that disconnect, and that's why you're seeing the patio homes, the apartments, the mixed use living in new projects and new urbanist projects, things of that nature were directly responding to this market demand as of a few months ago. And I think this transitions nicely to what Ted's going to talk about. And I love this quote from Urban Land Institute. In contrast to the past, a time when home buyers wanted their own space, future buyers will want everything closer. This was pre-COVID. People want density. They don't mind living in a certain place as long as they have access to walkable amenities and leisure around them. So I think a lot of this still rings true. I think walkability is still going to be paramount. I think amenities are still going to be paramount, but they're going to be different. The sporting events, the concerts, the festivals, the restaurants, those things are going to change and morph, and we'll talk more about that in a little bit. And I think leisure is going to become paramount as well in terms of the form of public spaces and places. And we'll get there in a few minutes. With that, I'll turn it over to Ted.
Well, thanks, John. So I think this was one of yours too, John, the millennials slide. So one of the things that kind of led us to start the whole discussion was sort of the idea of what the urban flight impacts might be of having COVID impacting at this time. And we know that already there's a significant migration from New York State and from New York City, and not just New York City, as this chart shows from Bloomberg News. There's the same situation is happening in Chicago and Los Angeles, and then the blue states on this map are the ones where people are moving to, and you can see significant number moving to Florida, Atlanta, Texas cities, and Las Vegas and Phoenix. And these are pretty significant numbers of folks. So next slide, John. So there's a company called Street Easy down in New York that helps people find apartments, and they had some very interesting statistics. They say that about 900,000 New Yorkers, and this is New York City residents, move every year. About 400,000 stay in the city, 300,000 move to the suburbs, and another 200,000 move out of state, represented by that map we were looking at before. And if you look at this, you can see that a lot of those people that are moving to the suburbs are moving to New Jersey, they're moving to Long Island, they're moving to Connecticut, but a pretty significant percentage is moving upstate. 6.3%, according to this statistics from Street Easy, are moving to Westchester and Rockland counties, and then another 11.8% are moving further upstate. And so we call these post-COVID factors. They're really factors that exist right now, and that's one of the big ones is affordability, loss of employment opportunities, and then the cost of living in the city are all, these are the three key factors that people mention. I know the governor thought climate was one of them, and it probably is as a statewide factor. So if we look at the next slide, we thought it'd be interesting to look at statistics for sort of migration out of New York City post 9/11, after the 2008 recession, and after Hurricane Sandy. And really, there is no good data about that right now. Only census data. After 9/11, about 2 million left the city, and that's between 2000 and 2010, so that could also be partly related to the 2008 recession. Another million have left the city from 2010 to the present. Interestingly, the city population was continually getting replenished by new people moving in and an immigrant population to sort of replenish the supply up until recently, where the population for the first time in the city has gone down in the past year. So looking at some of the migration trends towards upstate, if we looked at, say, another 2 million people fleeing New York City over the next 10 years, that's a sort of a major city being relocated up into upstate New York, and that would, be maybe 250,000 moving further upstate, and another 125,000 moving into Westchester and Rockland counties. Just anecdotally speaking to some folks down in the lower Hudson Valley in Westchester and Rockland counties, they're thinking that this migration is probably going to be greater than what was seen between 2000 and 2010. And it'll be interesting to see how that plays out. And so we talked a little bit about some of the current trends and future trends. Again, a lot of people are moving out of upstate New York, moving down into the southern areas, but so current trends, urban living still desirable. There's been an explosive growth in high density apartments, and I think a lot of investment has come on board because of the low interest rates. Probably, as John said, in the short term, people are going to look at crowded cities as undesirable and look at sort of decentralized services as being able to get access to healthcare, retail, even education in a less centralized setting in smaller communities. And another big factor is social equity. Some of the folks I talked to said that really the only people moving out of the city are the ones that can afford to. So I think with that, back to you, John.
Yeah, I think what's the new living arrangements, for people that leave New York City, clearly working remotely, I think was on on the rise. It was a trend we've been seeing growing over the last 2 decades. And I think now that we've all been forced to work remotely in companies and governments, which I think I was most impressed with how quickly New York State local governments pivoted to be able to accommodate working remotely and Zoom meetings and things of that nature. I was really proud, of New York's local governments to do that so quickly and adeptly. So I think working remotely is now going to be even easier as companies we're now all set up to do it. There's, I think more companies are going to be open to it. And I think that's going to lead to, again, further out migration from dense areas that may seem less comfortable. I'm trying not to use the word safe because I'm not a doctor, but less comfortable for people, because they can work anywhere and still be productive. So I think that's going to lead to a continuing shift away from areas like New York City. And I think, we keep talking about the D word, density. Is density bad? Is it actually crowding versus density? Crowding bad, density okay? I think density is an eye of the beholder. The people I've talked to in the real estate development world in anticipation of having this conversation with you today said, well, it depends. If you're talking New York City, in New York City, this is density. If you're talking, upstate communities, you don't see as much of this as the further you get up the Hudson and then, down the thruway to the west. These buildings are less and less common. So I think you've got to put density in terms of, not all density is created equal. And I don't think COVID's going to affect all the density living arrangements the same. So I think this type of living arrangement, I think, is what people commonly think of when they think of, geez, people aren't going to want to live in close quarters after this for a while. And I think this is kind of the common image that I think a lot of my clients get when they think of, living this close to other humans is a little uncomfortable right now. But when you start to go down the scale, down the transect of density, when do you say, oh, that's comfortable? That's an individual response. So as you're watching these slides, think about, what, I'm fine with it. I might be fine with this, but maybe you say no to that, but yes to this, or maybe that's still too dense and too close, or maybe yes to this, or I'm going to continue on down the line to single family homes. In very urban, this is an urban neighborhood, but still you've got your own small little patch of grass. It's detached single family homes, or some of these have been converted to multi-units, but again, it's more of a home setting where you're not living with 30, 40 other units in one building. And then finally, I don't think anyone would argue that 1 acre or more is dense. I think this is we can all agree this is not dense living. So the question becomes for your communities, and the answer is going to be different from place to place to place. What will the market bear, and what are people comfortable with? Because I can speak for at least down the thruway in Western New York area, this type of living arrangement with apartments in buildings such as this, or these type of living arrangements, are still going to be, according to the people I trust and in my opinion as well, these are going to be fine. I think this living arrangement is not so dense where it scares people. I think it starts to become when the term that my colleague and I came up with was elevator urbanism. Once you start to get into buildings with elevators, that becomes a density that planners love and I love, but that's where COVID might start to negatively impact the desirability of some of those, not all of those. I still think there's going to be a place for those, but I think it might be going to be more place specific. Whereas maybe the middle, they call them middle housing types like this, row houses and smaller apartment buildings, I think may become more acceptable and more comfortable for people as we go forward. I know we're burning through time quickly, so I'm going to go fast through retail. Another trend that we were seeing is obviously the decline in bricks and mortar retail and the increase in online shopping. Some of the numbers are not surprising anymore, but still shocking. In the loss of bookstores, home furnishings, office supply stores, you see the numbers here in terms of their loss of their sales by sector has been significant and continues to decline. Malls struggle. So what are the new repurposing of the malls look like? I think it's still anyone's guess, but we are seeing some things like healthcare We've had several mall owners and communities contact us as we do a lot of code writing. You know, how do we recodify the district that our mall is in to be more flexible, to allow for things like a remote hospital setting, something like that, patient care, outpatient as well as inpatient, actually hospital beds in a space that used to be occupied by a Macy's.
John, if I could, we got a question from one of our attendees. How do planners bridge and collaborate more with public health principles in a more regular way, is the question.
That's a great question. And it's interesting that I would say, speaking for my colleagues, I don't think we do it enough. I just don't think the conversation has been framed or asked, and it's no one's fault. You know, I don't think planners reach out to the medical professionals by default. I don't think it's just something that's on a radar screen often enough. And I think hospitals have so much on their plate, I don't think they reach out to planners enough. So I would say we both need to get better at it, but I think the person who can get both parties, planners and the healthcare sector, to the table is local governments. I mean, the times we've had conversations with healthcare providers and institutions has been at the behest of the local government through a comprehensive planning process or a recodification process. So I put a little bit of responsibility in a good way. I love local government. I think I empower you as a local government people to facilitate that discussion and bring planners and healthcare people together. Not saying we can't do it on our own. We talk to each other at conferences and things of that nature, but I really think that local government role as facilitators can bring us and healthcare providers together on a more regular basis. And I hope that answers your question.
Yeah, it seems like we're dealing with a little bit of a struggle between two types of things. We have these critical injury areas where we work as planners to reduce the likelihood of crashes in our community. And then code, where we're looking to develop communities that encourage healthy activity and people engaging in exercise to stem off some of the more chronic issues that you mentioned earlier in your presentation, like obesity and cardiovascular disease. COVID's kind of in the middle, right? It's both a chronic issue and a critical issue, and a critical issue, if you will. It is a peculiar question that we haven't faced since, I would think, the days of the Spanish flu, when we were looking at getting rid of the classic dumbbell style apartments to provide people with the air and light that were necessary to maintain public health and sanitation. So that is a great question. Something we'll have to.
Well, and the challenge, and Martin, to follow up on that, the challenge with COVID, my wife's in the healthcare industry professions. And so I know a little bit more than someone. I'm just enough to be dangerous, I guess. But the challenge is we really don't know enough about COVID yet. You know, we do know some things. There's absolutely some facts out there, but there's so much unknown. The lack of testing, the challenges, and to get our hands around it, as not only in terms of treatment and the pandemic, but also the root causes and things of that nature. I mean, we have some idea on what causes it and what we can mitigate, but we're still learning. Like I said, that one article that talks about some of the New York City issues could have been avoided is fascinating. And I encourage you to read it. So I think as more is known about the virus and the treatment and the transmission, it's going to challenge us as planners and board members to update our thinking very quickly as new information comes out. So I'm going to jump back in. No surprise here, online shopping was growing prior to COVID, and COVID has caused it to go through the roof. And I think what's safe to assume is, humans are behavior based, and I think it has really shifted some people that were reluctant to be online shoppers now fully into online shopping. And I think we all want to go back to the experiential retail at some point. Looking forward to doing that myself. But I do think online shopping, the jump it's received from going from 10% of sales to 25% during COVID will stick. So I think online shopping is really going to be even more of a new normal than it was 2 months ago. Looking at retail, and I'm just going to read this sub headline here, this subtitle. The big retailers will get bigger as mom and pops perish and shopping goes virtual. In the short term, our cities will become more boring. In the long term, they might just become interesting again. We're not here to talk about the future of cities necessarily, but it's a fascinating thing to think about. I think in the short term, I do think mom and pops are going to struggle. Again, not a big news flash there. So brick and mortar retail, mom and pop retail, along with some of the restaurant challenges, which we'll talk about, mom and pop retail, small spaces, which right now present a challenge with COVID, and some of the potential technologies that might be coming online, temperature sensors as you walk through the door, aren't going to be cheap. So these mom and pops are going to struggle to absorb some of these new costs, whereas the larger chains are going to just roll it into their annual expenses without missing a beat. So it's going to be a challenge to keep the shopping small movement going. Not impossible, but a challenge. I'm going to skip through some of these. I mentioned restaurants a moment ago. Since 2015, the US has spent more money on restaurants than in grocery stores. Pretty remarkable statistics if you think about it. We've really become we're all enjoying the golden age of dining. I saw one article that said, everyone's talking about the Spanish flu, and I think there's some parallels to be learned from that. This gentleman actually made the case that you need to go for restaurants, you got to go back to Prohibition, and Prohibition really changed the face of restaurants and what people did in terms of dining. And I'm not going to get into it, but it was fascinating, and that is actually something to learn from going forward. And I think going forward, restaurants are going to either be reduced, relocated, or repurposed. What do we mean by that? Reduced, unfortunately closed. That's it. They're just not here anymore. Hopefully that's not common, but I think that's going to be a reality for some restaurants. Relocated, a small physically constrained space might be what you've got to deal with in an urban setting, whereas in a more suburban setting, you can get more real estate inside your restaurant to get people safely dining at a distance. So maybe some restaurants relocate from smaller urban spaces to larger suburban spaces. Some restaurants may close altogether and go strictly to food trucks, or use food trucks as an extension. So food trucks were popular before. I think they're going to be more popular going forward. So make sure your codes can keep up with that and have dealt with food trucks in a meaningful way, because I think you're going to see a lot more of that. And as I said, with retail, I think smaller restaurants are going to struggle with scanners, separating dining cubicles and things of that nature, where I think the chains, the Dunkin' Donuts and those types of things, they're going to be able to roll those in. So I think the restaurant scene is, unfortunately for the short term, going to become more homogenous and more corporate. Hopefully in the long term, we can start to have more mom and pops come back online. But I think the restaurant industry is going to struggle and shift because of it. Ted, do you want to speak to education?
Sure, John. I was wondering about what was going to be happening with education. My daughter-in-law is a teacher down in Maryland, and she's been tasked with kind of the technology of online education for her group of students, and she recommended I go check out this website. It just came out like a couple of days ago, talking about what they're doing in Denmark, and they've already started social distancing. You can see this classroom's being taught outdoors on a cold day. So some of the other things they're talking about: reducing class sizes, which is going to require either more teaching or more hours for teachers. Long-term online learning may be a reality. And some of the technology inequities with staffing. Some of the staff may not be able to adapt to the new technologies that are out there and may not be comfortable with it. They're also talking about things like having to stagger lunch times, gym time, and recesses, so that they're reducing the number of children gathering in certain areas at one time.
Ted and John, again, I want to thank you for presenting all this. There's a staggering amount of impacts that could be felt by local communities, and trying to squeeze that into just a half an hour is tough. And I really appreciate your packaging. I do want to make sure that we're moving through, so we're preserving some time for our next speaker. So if there are a couple more points that you briefly make.
Yeah, thank you. No, thanks for that. Really quickly, I think public spaces are going to be paramount. You know, I think I'm going to go right to the takeaways. I think these are the takeaways that we're kind of building our practice on going forward. Is we're all scared, but keep in mind, people still want interesting places and they still want human interaction, even from 6 feet away. So public park space, public park design, sidewalks, transportation systems all need to change significantly. And keep that in mind. I think the one photo, this one, I love this photo of this park. This was pre-COVID, but it could be post-COVID. I mean, you've got small groups of people well in excess of 10 feet apart. So I think if there's less restaurants to go to, what are people spending their time doing? I think they're going to spend their time doing things like this. So I think we've got to really rethink our parks and recreation space in a revolutionary sort of way. Since we don't know what's coming, we want to be as flexible as possible. Make sure your zoning accommodates flexible mixed-use zoning. I think that was a best practice over the last 10 years and will continue to be so. So if you're doing that, stay the course. Community design is still going to be important. Biking infrastructure is going to be important. And I do think home downsizing and people looking like empty nesters looking for less maintenance is going to come back, but I do think it's on a short pause. And then I think my final point is, I'm going to read this quote. For decades, American cities have fought a battle against monotony. And according to some, the war was lost long ago. It was Tennessee Williams who allegedly said, America has only 3 cities, New York, San Francisco, and New Orleans. Everyone else is Cleveland. So the reason I bring that up is don't let COVID force monotony on us. I mean, I think the 50s and 60s, the engineering in terms of the transportation system and the Euclidean zoning, suburban zoning really created some boring places. And I think we've learned that they're not the best places and we can do better. And I don't want COVID to push us back into that out of fear. I think there's opportunity here to enhance and transform our communities if we look for it. And with that, I'll shut up.
Well, I want to thank you both. I do want to remind our folks that are attending, we are going to archive this presentation by video, so we'll have access to it. When that does get posted and where we decide to post it, we will let you know. We'll email folks so they can access it and share it. We'll certainly be emailing you after this presentation so you have a record that you attended. I really appreciate all the questions and comments coming in. I apologize we can't get to them all, but this is fuel for future webinars. But thank you again, Ted and John, for joining us and sharing the information you provided. Our next presenter is Jennifer.
Martin, we'll stay on after too. If somebody wants to talk to us after, we'll stay on after.
Okay, we can certainly do that. Yeah. Our next presenter is Jennifer Ceponis, a senior transportation planner with the Capital District Transportation Committee. She is one of the primary authors of the committee's draft New Visions 2050 plan. That plan, released in March of 2020, outlines policy, investment principles for investing in transportation infrastructure here in the capital region to develop a sustainable 21st century transportation system. Jen's going to talk about how the region will implement New Visions 2050 and what we consider a post-pandemic world. How can New Visions guide the reimagining of the capital region communities and how we move around them. So with that, I'll turn it over to Jen. And Jen, I want to thank you for joining us today.
Sure. So I just want to make sure you can see my screen.
We can see your screen, although we are on a presentation view.
Okay. But it just sees the slide, right?
I can see your slide and your next slide's coming up. Maybe if you hit play or switch your screen.
Huh. Okay. Hold on one second. Bear with me. I'm sorry.
Yep. That's all right. One option we found in the past is if when you're selecting your screen share, it gives you a bunch of options if you're using multiple monitors like I am. Which gets and you can select different types of options from that menu.
While we're waiting, I will point out that both Martin and Jen are in the same house right now.
Using all the Wi-Fi.
And they also have an 8-year-old son who is, I hope, occupied somewhere. I just really appreciate the logistics of doing this, but thank you both for making it happen.
Sure. I have no idea what our 8-year-old is doing right now, but he'll be fine.
He's fine.
Okay. I'm just going to share my screen and get going. I have 2 screens, so it's a little confusing right now. Okay. Do you see the whole screen?
Yay!
Yay.
Perfect, Jen.
Great.
And I'm not
Okay.
just saying that because you're upstairs.
Okay. So let's just see how this works. Okay. So as Martin said, I'm going to talk about the long-range transportation plan for the capital region. We call it New Visions for a Quality Region. We recently released this to the public, which I'll talk about. And then shortly after, we're faced with a public health crisis that has canceled our public outreach, original public outreach plan, or I should say shifted things a bit, and has us thinking maybe a little bit differently going forward about what a post-pandemic capital region could look like, or what principles are kind of stand out or might shift a bit. So I'm just going to go through this quickly for people not familiar with the Capital District Transportation Committee. We are a metropolitan planning organization, or an MPO. And the Federal Highway Act of 1962 established that MPOs be designated by governors for metropolitan areas with populations over 50,000. It's a forum for planning, policymaking, and decision-making for government agencies and elected officials. So it's where decisions on how to spend federal transportation dollars are made. And there are currently 14 MPOs in New York State. The CDTC is the MPO for the Albany, Schenectady, and Saratoga Springs urban areas. We have 77 municipalities, population under 1 million. We were established in 1964. And, we are unique in that we're multinodal, and we also are here in the center of the state's government. So there are various documents and policies that CDTC is required to maintain and develop to comply with federal transportation legislation. And the most important one is the Long-Range Transportation Plan. So CDTC refers to our regional transportation plan as New Visions. This is a 30-year plan, our New Visions 2050, that outlines investment principles and planning strategies that will guide the region towards developing a transportation network that we need. The plan addresses national, state, and regional funding priorities and reflects the needs and concerns of local communities. It is, like I said, our key document, and it really lays the groundwork for everything else we do. So how we program capital projects and all of the planning tasks and initiatives that are done at the MPO. So what's in the plan? We released the draft New Visions plan in early March, and the plan includes an executive summary document, a systems performance report, a public participation plan, 11 technical area papers, so everything from bike ped to safety to infrastructure, a financial plan, and of course a glossary of terms and abbreviations, because us planners and our acronyms and everything and fancy terms. So shortly after the plan was released in March, for public comment, we had to cancel all our public meetings and in-person meetings and shift everything to virtual. But before this even happened, we were developing and planning for a range of strategies for collecting input. So even though we've had to cancel these in-person meetings, we have a whole web page with a range of ways for people to participate. Of course, this is difficult for people who don't have internet access, and we're working on ways that we might be able to reach out to those people. But right now, we have a web page set up where people can take a funding poll, and it's kind of a fun exercise. You can decide how to spend transportation money, how you would spend it and prioritize it. There's online surveys. We were also developing a meeting in a box, or like host your own meeting type of toolbox, which is, still useful. People can still host their own meetings, download questionnaires and a dialogue guide and activity books. You could do it by Zoom. And of course, we're on social media, and you can still request information traditional ways. So to adapt and be more flexible, instead of doing two separate public input phases, we're just going to do continuous public involvement through September. Really try and amp up our virtual public involvement in the next couple of months. And then as soon as it's safe, try and do some public events or in-person meetings in the future. So for anyone not familiar with the capital region. Well, I think most people on here probably are. You know, we're a unique multinodal area that includes 8 cities, a number of unique towns and villages. We're connected, of course, by a series of highways, arterials. We're also an economy, and the region is situated at the crossroads of 2 major interstates and 2 major rivers. So there's a diverse range of communities, from vibrant urban centers to rural agricultural lands and villages. We're an attractive destination to visitors because we have a high number of social, cultural, and recreational opportunities. And it's the home of the state capital, so it enjoys a stable economy bolstered by the large state government workforce and a number of colleges and universities in large medical institutions. Despite these advantages and consistent development throughout the region, we've experienced pretty low population growth, and it wasn't projected to increase significantly in the future. Despite the growth, the region has seen quite a bit of development. Consistent with national trends, we've seen multi-unit housing development outpace single-family homes unit for unit, because of the continued development without a huge amount of growth. The region is more spread out, there's more driving, emissions are up per capita. So the region has a good network of highways, bridges, sidewalks, trails, bike facilities, and bus rapid transit, and there are capital plans and concepts to expand much of this. So we have been moving in a very good direction. And we've developed and connected this network incrementally through careful planning throughout the years. In recent years, we've updated and developed several major regional planning documents for the region, which provide a framework for continued investment in infrastructure that improve quality of life and connect the region physically, socially, and economically. We've seen a huge expansion of electric vehicle charging, and we've actually developed 2 electric vehicle charging station plans. As that has evolved, we've had to update that. That's an example of a technology that's evolving very rapidly and changing the transportation landscape. We have significant amount of freight and goods movement with port and airport and other facilities. Our regional trails network is a huge asset for the region. We have about 150 miles, and that has been growing. And then, of course, our local road safety plan, looking at how we can reduce fatal crashes on our local roadways. So during the Great Recession, around 2009, 2010, there was a lot of shifts in travel, particularly a decrease in driving, but the region has mostly bounced back. And while it hasn't completely returned to pre-recession levels, things are leveling out back across all modes. We've collected data that indicates that walking, bicycling, and transit use is growing for non-commute trips, but for commuting, largely the region is, 80% drive alone to work, just 10% are walking or bicycling, but we have seen an increase in transit use in the region. An expansion in that sidewalk network, the trails, our transit has created more travel options than ever before. About 50% of the region's population is within a quarter mile of a transit route, which makes accessing a bus to get to work or where you need to go pretty easy. Both TNCs like Uber and Lyft and regional bike share systems started operating in the region in 2017. So there has been a growth in shared mobility and that mobility on demand technology. We've seen an increase in telework, which we expect to continue to grow, and of course, other alternative transportation modes. So while we've developed a reliable and multimodal system, we are anticipating some major changes, possible disruptions. We didn't anticipate this disruption, and a growing issue and other concerns that affect our transportation system. The market for personal mobility is changing rapidly due to changing social and cultural trends, but also because of technology. Smartphones and widespread data connectivity have made way for new mobility concepts and solutions like bike and car share, on-demand services like Uber and Lyft, and now we're starting to see microtransit. And on top of cultural and technological shifts, we're also tackling big problems that are not unique to the capital region, but inequality, climate change, and just funding uncertainty. So we used to be able to look to the previous 10 years when we would develop a long-range plan. We would measure population growth, count building permits, estimate vehicle miles traveled, map where people are going, and then make some pretty good assumptions and projections for the next 10 or 20 years. And then decide what we should build for. And, you know, we have seen that in the past, in transportation planning, generally we've overestimated traffic growth in some places and underestimated in others. But for the most part, traditional planning and funding models have been kind of disrupted in the short term by this really rapid change in mostly technology, but also just cultural and social trends. So we're seeing the need to update our transportation plans much more regularly. Things that we're anticipating here in the region and trying to plan for, of course, are autonomous vehicles. There's no consensus on a timeline or how these will impact the system, but we are exploring this. Equity, electrification of the system, climate change, the disruption by new mobility services, funding uncertainty, of course, again, technology, and then transportation costs. So data and trends show us that we can do better at providing sustainable transportation and mobility options. The cost of owning and maintaining a private vehicle in our region has increased as a percent of household income, particularly for households with low incomes. Transportation as a sector is the largest source of greenhouse gas emissions at 34% statewide, and here in the region it's 40%. So statewide and in the region, we've really tackled this problem of emissions in the transportation sector by supporting electrification and associated infrastructure, investing in bike ped facilities, reducing congestion, expanding public transit. But in order to meet the state goals of reducing greenhouse gas emissions by 85% by 2050, there's clearly more work that needs to be done in the transportation sector, and we support that. So there's been, as I've mentioned, technology. There's kind of been an evolution of technology, and it's created a growing role in transportation and mobility. Connectivity has enabled the proliferation of shared mobility services. Smartphone applications allow individuals to hail rides, reserve bikes, rent scooters by the minute. And smart technology is being integrated into the system to improve operations and delivery information to users in real time. So we're seeing these three revolutions in transportation: the electrification, automation, and then the increase in shared mobility. Understanding the likely effects of growth and change on the region is essential to identifying decisions the region's leaders might make to meet state and regional and local goals in the long term. And these rapid changes, these changes that we're seeing, again, technology, social, culture change has made the future more uncertain. And one of the most anticipated technologies in transportation planning is automated vehicles. So there's no consensus on how these will impact transportation system or land use. And there's no timeline, like I mentioned, for how or when these might be deployed. Will they make owning a private vehicle less attractive to sharing a fleet and using an on-demand service, or will people continue to own private vehicles and AVs will allow them to live further away? We know that they can increase capacity of roadways without any new infrastructure investments because they can follow closely and they can avoid crashes. But again, will this increase vehicle miles traveled or decrease it? Will they be electric? All this is unknown, but we know that we want to invest and support a future where these three revolutions kind of come together and are able to expand mobility and lower environmental impacts. Is this not going forward? It's not moving forward. Is my screen not moving anymore?
Your PowerPoint frozen or the Zoom?
The Zoom.
We just want to talk, give it a second, maybe it'll catch back up.
Maybe stop sharing the screen and then start sharing it again.
Yeah, that's a good option.
Sorry about this.
That's okay.
Huh.
So sharing is,
Okay.
there we go, yay.
Yay. Okay. So one way to plan for uncertainty is through scenario planning. So for New Visions, we have contemplated 4 development scenarios for the region. Scenario planning is kind of a structured way of thinking about an uncertain future by identifying conditions or events that are probable and understanding their likely consequences and determining how to respond or benefit from them. So as a region, we really need to consider the trade-offs and opportunities between these competing scenarios, which builds a more equitable and vibrant communities that support a quality region. So we've developed these scenarios, and then we've also considered in all of these scenarios kind of these overlays that we refer to as optimistic autonomous vehicles and pessimistic autonomous vehicles. So assuming the good impacts or bad impacts of autonomous vehicles on each development scenario. So as you can see, when we looked at the potential impacts to the region based on where development and what it might look like, this is what we kind of came up with. Is obviously in the sprawl development scenario, we would see less walking and bicycling, more missed opportunities for regional attractiveness, less transportation choice, more greenhouse gas emissions. And as we move towards concentrated development, and then, you know, in an optimistic autonomous vehicle scenario with some major changes in policy, we could even see concentrated development with financial incentives. So there being incentives for you to not drive as much or to use shared fleet. So we see more walking and biking, walkable communities, more active transportation, reduced greenhouse gas emissions, overall increase in regional quality of life, protection of open spaces, and generally more transportation choices for everyone. So New Visions 2050 is, you know, we're developing a vision that means creating goals and developing a set of investment principles that encourage concentrated development, because our goal is to develop what we call this quality region. So creating and sustaining a quality region that has sustainable and equitable urban, suburban, and rural communities. It leverages infrastructure investments for economic growth and other creation of opportunities for all of our residents. So some of the, as we go through the 11 technical area papers, there's a lot of themes and recommendations that are, you'll see that kind of points to these overall best practices for getting to our quality region vision. So of course, maintaining a state of good repair on infrastructure. CDTC encourages funding to be prioritized for construction and reconstruction of pavements, bridges, sidewalks, and other existing infrastructure in order to maintain a reliable and structurally sufficient regional transportation system. And this is an important principle for all modes of our transportation. Maintaining congestion and not adding new capacity, so not adding or widening roadways or highways. Strategic removal of bottlenecks can be relieved through the use of less expensive strategies and evolving transportation technology. Additionally, there's an opportunity to right-size existing roadways that were built years ago based on other traffic forecasts and other conditions, and of course, underutilized right-of-way can be used to improve access for other modes like walking, biking, green infrastructure, transit. We've long advocated and supported the implementation of complete streets, and New Visions 2050 continues that. We do feel that complete streets is a transportation policy and design approach that can help plan, design, and operate safe, convenient, and comfortable travel and access for users of all ages and abilities, regardless of mode of transportation. Encourage smart land use planning, support transit-oriented development and smart growth. We believe we need to continue to encourage planning for new development and redevelopment that encourages walking and bicycling. This means promoting, of course, a mix of land uses, increasing density to improve efficiency and reliability of services, particularly transportation services like transit. This type of development attracts new economic activity, generates tax revenue, and creates new jobs. And these policies are fiscally responsible and help attract investment to our region's existing infrastructure. Encouraging adoption of safe system and Vision Zero's policy is something we haven't done yet in the region, but that we see as a key finding of our local road safety action plan. We feel, we are encouraging local governments as an implementation action of that plan to adopt Vision Zero policy or these safe system policies. They can be tailored to the community context and crash patterns. And they really are the foundation of creating a safe system that reduces crashes and improves safety for all. So from all of our findings and our goals of creating a quality region, we've developed these 15 planning and investment principles. And they are elaborated on in our New Visions document. You can find details on them, but in short, it's invest in a quality region, support economic development, make investments regionally equitable, preserve and manage the transportation system, maintain travel reliability, invest in safety, invest in security, invest in complete streets, encourage bike and ped travel, move freight efficiently, invest in transit, provide essential mobility for all, prioritize affordable and convenient travel options, preserve the environment, and leverage technology. So our planning and investment principles are the centerpiece of the New Visions 2050 plan. They're directly related to criteria used by CDTC to evaluate proposed projects and prioritize them for funding in the TIP. They were developed and proposed over time by our New Visions task forces, which include members of the community, public-private sector representatives, our state agencies, or local government. So they're really developed collaboratively throughout the region. And these principles influence the types of tasks and initiatives that we support. So then things changed. Uh-oh, now my screen's doing it again. Oh, here we go. Okay. So as I mentioned earlier, we released the New Visions 2050 draft plan in early March, and shortly later after this public health crisis happened. And we have seen a huge impact to the transportation system just in the short term, and we anticipate that there may be some changing priorities or thoughts on how we recover or reimagine things afterwards. So you can see in the graph on the right, this is traffic data from our region. It really significant traffic falls right when the New York State on pause policy was implemented around March 15th. It has been at about 25% of our baseline traffic since, and really hasn't gone up, even though, you would think after a month or so, people would be fatigued from staying in and start getting out. So there's been these 5 major actions in our region and across the country to adapt our transportation systems to social distancing. And these have been, of course, responding rapidly and implementing plans to reduce crowding quickly, relieve crowded areas to support public health and social distancing, create clear messaging of policies to the public, provide safe and efficient transportation to testing and medical facilities, and then support unsheltered and vulnerable populations. So you may be familiar with changes to CDTA to protect transit workers and relieve crowding situations, but to continue to provide transportation for essential workers, CDTA has modified their service and protocols. They've increased service to medical facilities and grocery stores. They implemented rear door boarding only, and they suspended fares. You may have noticed more people out bicycling, both recreationally and essential workers choosing to bike to work. Or if you've been out to a trail, you may have noticed that they are quite crowded right now. Some cities have used, not in our region, but we've seen across the country, some cities use the reduction in traffic to open streets or reallocate space to relieve crowding and improve safety. This is just a list of some of the
just for a moment, pardon the interruption. Yeah. We had a question earlier about the impacts of the New York pause and the COVID virus on boardings and the utilization of our transit system. Is there any anecdotal evidence you have to share about the impacts of the virus on people getting on and off the bus?
Well, I mean, there has been a decrease in general ridership. I don't have any data to share right now, but there has been a decrease in ridership. And of course, that's been in most transit systems right now, but we haven't seen, while CDTA is definitely trying to protect transit workers and people using the bus, I don't think we've seen any particular clusters or spreading directly related to transit here in the region. I know, just from being out and about, you see a lot of people still waiting at bus stops. There's a lot of people who still need to get places. So transit has been an essential service throughout all of this.
Thanks.
Sure. So just going back to relieving crowding, kind of using the street to extend sidewalk, we've noticed that our sidewalks are not as wide enough in all areas to accommodate social distancing in that 6 foot space. Some cities have done one-way sidewalks to reduce those conflicts. But I think we'll continue to see cities get creative about this. Repurposing some of our transportation assets. So how can existing infrastructure be reimagined for current needs? We've seen some of some transit buses or other vehicles being used to deliver food and meals, even here in the region. Not in our region, but in other parts of the country, parking garages were converted to overflow medical facilities. Of course, sidewalks are being used to manage queuing and reduce crowding in grocery stores and other places. And then, of course, testing. So right here in our region, just in the last couple of weeks, we've implemented a few mobile testing sites, because for a while it was drive up only. You had to stay in your car. And if you didn't have access to a vehicle, this was difficult if you needed to get a test. So we've been happy to see the walk-up sites established. So in New Visions 2050, we talk a lot about resiliency. We have a chapter in our environment and technology white paper about resiliency. And we talk about it as the need to plan infrastructure investments to be able to withstand potential threats, mostly considering extreme weather and natural disasters, terrorism. And we hadn't thought about or considered the role of transportation or the impact of the system during pandemics, but now we definitely are. So we've been tracking changes and impacts during this public health crisis, and we're beginning to think about what a post-pandemic region looks like, or what recovery might look like for the transportation system. In general, it seems like it has and will continue to accelerate changes that were probably already going to happen, but we were already seeing or anticipating. So, we were seeing an increase in telework and working from home, but, could an acceleration or a significant increase in telework mean population growth from our region? In the previous presentation, we talked about people leaving major metropolitan areas. The capital region could be an attractive place for people who are looking for livable metropolitan areas that still have that vibrancy and yes, density of a city, but not quite the crowding situation that they might experience, or what it might worry them in like a New York City or a San Francisco. Transit ridership, how will this be affected after all of this? Will people still be avoiding transit? We know that transit is really vital and essential to moving people, and we need to be able to provide the service in a safe way, reduce crowding, but increase service. So hopefully this doesn't result in a shift away from transit. Equity was already an increasing concern, and we've heard the governor talk a lot about environmental justice, and the areas that seem to be affected the most by COVID-19 are environmental justice areas. They're areas where air quality was already of concern because of industrial uses and other things. So thinking more about that. I saw someone had asked about parking management. I think one trend in parking was seeing more a shift to curb management as things like Uber and Lyft and stuff have increased. So we may see an increase in that. If you're in Albany or Troy, you've seen that a lot of the parking areas that were managed by paid parking have been converted to like pickup, drop off, and being managed differently. And we could continue to see an expansion of that and how that's done. Of course, highway congestion and capacity, continued trend towards right sizing. We talked about land use. I know we keep talking about density, but I think it's important to look at the bigger picture and really distinguish the difference in overcrowding versus density. And in New York City, you have issues of affordability and other socioeconomic issues that have created an overcrowding issue, which has been more problematic than just the density. So, making sure that there are enough housing units for the number of people and that they're affordable for people to live and be safe. And then, of course, preserving our infrastructure system, but then also, well, as we're making investments, infrastructure can be a stimulus. So making every dollar work to create jobs and new economic activity. So we will be updating our resiliency chapter in the Environment and Technology White Paper to document how the region has adapted and recommendations for managing the transportation system during pandemics in the future, just general public health concerns. Hopefully we will be able to do that in the very near future. Hopefully we won't have to respond to a pandemic again, but I think there are a lot of useful lessons that we're learning and can be adapted to potential future issues. So if anyone is interested, there are quite a few resources available right now on COVID-19 response in transportation. NACTO has developed kind of a database of what cities and states are doing across the country to accommodate social distancing. Bloomberg Philanthropies has a toolkit for cities. There's a lot of data. Google Mobility Reports and Esri GIS have lots of really great data for local governments. So as I mentioned, we're shifting things a little bit for our public input for New Visions. You can schedule a virtual meeting or host your own meeting. You can visit the webpage for New Visions, send an email, or just get in touch with me, and I'd be happy to answer any of your questions or schedule and coordinate a meeting or presentation or anything.
Jen, I want to thank you very much for taking the time to present to us. I'm sure people will check out the resources that you have provided. If they do have questions or comments concerning the content of our webinar or suggestions for future webinars, I'd really encourage people if you could stop sharing your screen for a second, Jen.
Yeah, I'm trying, yeah.
People to reach out to us. My email is mdaley@cdrpc.org. If folks want, they can certainly check out our website for opportunities to attend future webinars. We'll be in touch about those. Our webinar series will run Thursday mornings at 10 o'clock throughout the summer. A little plug for our next one. It'll be about the types of situations where planning boards and Board of Zoning Appeals members might approve a particular project and then something else gets built in its place. So that'll be called, that's not what I approved. So I would encourage people to sign up for that if they're interested in those. An email will be sent to all of our participants at the close of the webinar. That email can be submitted to either the chair of your planning board or your town or city or village clerk for consideration for credits. New York State Department of State gives municipalities a wide latitude to be able to set their policies as far as what they'll provide for credits. We'll archive this presentation with a recording, so folks will be able to check up on that. But again, I really want to thank all of our presenters for taking the time this morning, and thanks to folks for joining us for this. We will certainly be in touch about future webinar opportunities. And if anybody wants any contact information, slides, we had a question about slides. We can see about archiving those on our website. Absolutely. We'll provide those resources. And but with that, I realize we're over and I want to be respectful of folks' times. So thank you very much for joining us. Very much appreciate it. And we hope we'll see you on the next webinar. Take care, everybody. Thank you.
Thanks, Martin. And I'd just like to thank our sponsors, the Capital District Transportation Committee and Barton Loguidice.
Yes.
I know if folks want to stick around for Q&A with any of the speakers, I know John and Ted are available, so we can leave it open for a couple more minutes. Thanks again, everyone.
I'll give folks a second to pull them up in the chat. I don't see any questions other than our archive.
Martin and Mark, one of the questions, and this person has since left the conference, was with regards to the numbers we had on our slide of folks that could possibly be migrating upstate, and that was derived from, you know, a percentage of people by this this group that helps locate people in apartments and homes in New York City area, that said about 11.8% relocate upstate beyond Rockland and Westchester County. So just on the anecdotal suggestions that 1 to 2 million folks could be leaving the city over the next 10 years, that's where that number came from. 11.8% of, you know, say 2 million folks could potentially be relocating upstate.
All right, I think we got to all of our questions, so I'm going to click the end webinar. Again, thank you very much for everybody for joining us. Very much appreciate it. Take care.